Hello and good evening, everyone. Today, as you all know, that the session is about nutrition and exercise, and I will be guiding you with some nutritional advices. So, as we know that there are many kind of lifestyle diseases these days, like hypertension, diabetes, autoimmune diseases, metabolic diseases, hormonal disorders like thyroid and PCOD. We know that a bad lifestyle, that is, the word meaning of lifestyle, the way a person lives. Okay, he or she is living the way they are living. It is known as lifestyle. So, because of the bad lifestyle, uh, not eating a balanced diet or inappropriate nutrition, lack of sleep, poor quality of sleep, and lot of stress has been responsible for causing such kind of diseases. So there are different forms of we are seeing in homeopathy. So this is given in an organon of medicine, that is aphorism number 260 and 261. We can see that obstacles to cure, uh, like the errors in the diet, have been many a times responsible to be the obstacles in the cure of the chronic disease. Aphorism number 2, you can read that the most appropriate regimen during the employment of medicine in chronic diseases consists in the removal of such obstacles to recovery and in supplying where necessary the reverse innocent moral and intellectual recreation, active exercise in open air in almost all kinds of weather, that is daily walks, slight manual labor, suitable nutritious unmedicinal food and drink, etc. So you can even see in our organon of medicine that how much importance nutrition as well as the movement, that is the kind of exercises are given. So what we do in our clinic, along with homeopathy, that is our clinic team takes an in-depth case taking, and sir tries to find out the pattern of the patient, and according to that a minimum remedy is given. And along with homeopathic medicines, our nutrition team takes a case taking according to nutrition point of view, and an individualized advices are given according to that. And then the patient is referred to our trainer, that is Mr. Nikhil More sir, and then he guides them with a proper set of exercises. So what we suggest them, like we look into the routine of the patient, we look into what complaints they are having, like what are the major diseases which they are having. We see we like try to formulate a plan for them. And not only it's just not about nutrition, like that it is not about diet, or it is just not about exercise, but also we look into the sleep pattern of the patient, that what is the time at they get up, what is the time they are sleeping, and how many hours of sleep they are getting. And if they have some kind of psychological trouble, or they are not doing well at that level, also at mental health also, we refer them to some to our psychologist also, who guide them, like who give them consolations. So we do that also. So many a times, like when we are seeing our patients, we look into the sleep cycle, we look into their hydration. The hydration is very, very important. There is the amount of water which you are drinking throughout the day. When we are taking a case history on a nutrition point of view, many of the times what we see, many people are suffering from migraines and headaches. And when we ask them how much water you drink throughout the day, they tell me that we drink 2 glasses of water or 3 glasses of water, because we don't get time. So this is the answer many times which we got. But the hydration, keeping your body hydrated, is very, very important. So that is also a very significant thing which we have to guide our patients. And today, because of this westernization, lot of westernization, people are going to lot of cafes and restaurants and eating a lot of outside food, that is a junk food, and we use frozen food, packet food. So this is all affecting our lifestyle, and it is affecting our body, and it is responsible for causing many, many diseases. So we ask our patients to kind of avoid processed food, avoid sugar in their diet, which is causing a lot of toll on their health. And in this way, like guiding them on different aspects, we help them. Why I'm telling you all this, like being a homeopathic student or being a homeopathic practitioner, we must know that when it is a time that we must refer our cases to a specialized nutritionist, or when we should tell them to do a proper exercise. And we have been using different types of diet also, like you must have heard about a diet pattern known as intermittent fasting, calorie deficit diet. So many a times we, according to the complaints which they are having, or like if they have come for weight loss or they want to gain weight, according to that we give them like we guide them along with that. So it is not just that giving them plan and just leaving it, and but we follow up with them in very every 15 days, or depending upon for what condition they have come to us. So this is the whole concept, and I would like to give you some idea about, like suppose some of the patient is has been like given medicines for diabetes, hypertension. So what we do also is that for diabetes we tell them that you can do walking, like walking for 15 minutes after your meals, like especially lunch and dinner, which helps you to regulate your blood sugar levels. And also we try to give them some kind of herbs and spices, like there is a very there is a kind of a superfood known as moringa leaves, which are help to reduce the blood sugar levels. There is cinnamon, which helps to reduce the blood sugar level or regulate the blood sugar level. So along with our homeopathic medicines, we try to give them some kind of ideas about some herbs and spices which can be beneficial for them. Okay, so the whole idea. So one more thing I would like to tell you is there is a kind of in Japanese philosophy, or there is a kind of the rule. The Japanese people always eat 80% of the capacity, and we kind of Indians have a tendency to eat like lot of food, which has been responsible for causing many diseases. Even a lot of American people have a lot of issues of obesity because they eat a lot of junk food, and they eat over their capacity. So what Japanese people do, their rule is to increase the lifespan of a person, that is to increase the longevity of a person. They will always use 80% of their capacity, and they will leave the 20% of their, like the appetite which they are having, they will just leave it. So when you are eating, and after 12 15 or 20 minutes, you will feel there is a kind of satiety, that you are feeling full now. So we have to just give a time of 10 to 15 minutes after eating to feel that completeness or like fullness feeling. Okay, so we don't have to like tend to eat a lot of the food. Sir giving advices to our patients. Okay, so we, this is our team, sir, and Dr. Shrishti, myself, Dr. Bhavika, Nikhil sir, we are a like part of integrative team. And yes, of course, our whole clinic team, Dr. Utsav, Dr. Shivani, and Dr. Megha, Dr. Jaya, we all together are working to help our patients in whatever way we can. So the whole idea behind this is to bring the holistic approach, to bring the whole approach. Okay, and we do whatever we can. It's just not about homeopathy, it's just not about diet, it's just not exercise, but along with that we see sleep, we look into meditation, we look into mindfulness, we look into psychological counseling. So whatever best is possible for our patients, we try to help them with that. Okay, so this is about the integrative uh, this is our approach. And if you really want to like you, the main idea is you should bring this changes in yourself also, and in the life of others also. And Gaurang sir started this whole platform because he's just not like he, this is not for only others or not just for patients, he himself applies this on it, like he does everything what I have, whatever I have told you today. Okay, he's just not like he's doing for the sake of doing it, but he applies it on himself. And being a homeopathic student or a practitioner, it is the best thing. When we are advising our patients and our family members and others, we should first apply it on ourselves. Okay, so for any if you will be having any doubts, any queries regarding this whole concept, you can email us, you can message us, or you can DM us on our Instagram page. So thank you so much for listening out to me. And now the further session, like the exercise session, which you are waiting for, will be started by sir. Thank you.